Welcome to Overbury Farms and Farmer Jake's YouTube channel. This is the first time I've ever done any interviewing, so please bear with us. It's a little bit of a different scenario at the moment. We're in Upledden Village Hall and I'm joined by Phillipa Lord. And Phillipa, could you just tell us a little bit about your job and what you do and who you work for?
Yes, I can. I'm Phillipa. I'm a farm vet from Wood Vet Group in Gloucester. I do have a big interest in sheep, and that forms quite a large part of my work. I also am quite actively involved in flock health planning, which involves looking at the entire flock and making a plan about veterinary health matters.
Brilliant. And through our Sainsbury's development group, flock health plans are becoming really, really important, so we can assess the whole flock, not just on an individual basis. And tell us how that's going to benefit us as sheep farmers.
Okay. Basically, flock health is really important in terms of production, but mainly in terms of health and welfare of sheep, and that's my angle. If we can get health and welfare right, and if we can get productivity right, that will in turn help you produce a healthier flock of lambs, which are healthier and productive at the end of the season.
Brilliant. And one of the problems that we've identified through some of the sheets coming back from the abattoir is something called C. tenicolis, which I believe is a dog tapeworm. Could you just give me just a really quick overview of the life cycle and how people walking with dogs on our farmland can play an important role in trying to reduce its influence, on our sheep health flock?
Yeah. C. tenicolis and C. ovis. These are sister circus, obviously the sister circus tenicolis. They are cysts which develop in the sheep. They come from a tapeworm that is present in the dog, and the tapeworm sheds eggs whilst in its adult form in the dog. It sheds eggs which are then passed out in the faeces. These faeces obviously are then deposited on grazing land, particularly important where there's footpaths going through fields with sheep in them. Once deposited on the ground, the eggs that are in the faeces can survive for up to 6 months. So the sheep, over a period of time, the faeces will disappear but the eggs remain. The sheep come along and ingest those eggs. The eggs then are swallowed by the sheep and they migrate. They start to undergo changes and they migrate through the intestines and into the different parts of the sheep. In the case of C. ovis, this would be into muscles such as the heart, which is a muscle, the diaphragm and the skeletal muscle. And in C. tenicolis, these the cysts and the larvae will then start to migrate through the abdomen and through the liver, which can cause pain to the sheep. The most important things are that the cysts then develop into the sheep carcass, which would mean it would be condemned if when it reaches the abattoir, because it would not be fit for consumption, and also it can cause pain and distress in the sheep, and in some cases it can cause death.
Brilliant. So that's the effect on the sheep. As a farmer, there's absolutely nothing we can do about it, bar worming our own dogs, which we do as part of FABL, Farm Assured British Beef and Lamb. So what options do the visiting public have to try and help us in controlling this problem?
Okay. The life cycle, just going back to the life cycle of the tapeworm, the life cycle is then completed if a dog is able to eat an infected sheep. So if these sheep die upon the woodland and or on the fields and they then eat parts of that sheep, then the life cycles continue. So the farmers are very good at removing dead sheep as soon as they see them, and footpath walkers actually play quite a good part in this because they will highlight dead sheep to farmers. So that's one thing that they can do. But the two most important things is that the dog walkers must pick up the dog faeces when they're laid on the ground, and more importantly, they must treat the dogs for tapeworms. We can't treat the sheep because the tapeworm isn't in the sheep, only the cyst is in the sheep. The actual tapeworm's in the dog, so we have to treat the dog, and that would involve a wormer that's usually obtained from a vet, or you can get them from a pharmacy, but the most important thing is that the active ingredient is praziquantel. It must have that ingredient in it, and you must be dosing the dogs to their correct weight.
Fantastic. Philippa, thank you very, very much indeed for that, and you know, stay tuned for more Farmer Jake YouTube videos.